The way I interpret an indeterminate test has really changed and evolved since we started to do this type of testing. When you start hearing the term indeterminate, your first thought was, well, this test wasn't helpful. And that initial reaction is really not the case. And when I really learned kind of how this worked, I realized that what indeterminate really told me is that Nodify may not have found things that directly rule in cancer, but it also didn't find what we were looking for to rule it out either. And when we see that pattern, it means that there may still be something there that still is malignant and it's just indolent. We need to go into that even further. In those patients, when we started to see indeterminates, I started to see a higher proportion of them actually being malignant. So indeterminate to me is a warning sign. It is not an unhelpful test. It is actually an extremely helpful result.
So in the early days, indeterminate just meant indeterminate, right? This didn't really help us clarify as to lower the risk or increase the risk. So we're going to handle this how we would have according to standard practice half a decade ago. As we're all learning, right, that indeterminate probably is more of a warning sign, that there's less likely a balance of inflammation to cancer risk. And so probably it's somebody we need to watch closer. And so then it goes down to patient preference. So, hey, you have indeterminate. It does make us concerned that, although we're not technically raising your risk, it's raising our concern. And so your options, PET scan or biopsy, are on the table. How would you like to proceed? Here's your risk benefits of each. So I think it allows us to have a little bit more aggressive, suggestions on the case. It doesn't, to me, it does not conclude that I have to have a biopsy, but it definitely doesn't conclude that I can wait. I think survey is your best option on an indeterminate. I would say no, I don't think that's the case. I think we need either biopsy this or do a PET scan if it's an option, and then have you back in a short interval and see what we find.
I think an indeterminate test result is somewhat of a misnomer. It's not indeterminate, it's just truly intermediate. The last thing that you want is a test that feels compelled to have a binary classification, either lower or higher. Some nodules truly are in that intermediate risk category and can't be reclassified, and that's okay. Because if you can at least reclassify a portion of those intermediate risk nodules, you're going to be helping many patients. I am okay with an indeterminate or an intermediate result. In those cases, I simply do what I was going to do before. So when I see a patient in clinic, we go over their CT, their PET scan, their PFTs. We talk about the different options. I make a recommendation, and ultimately we come up with a plan for surveillance or for biopsy. Then we get the Nodify test done. We have the results back in a very timely manner, and sometimes that changes the plan. If the test is intermediate or indeterminate, as you say, the plan doesn't change. We just do what we were going to do anyway.